Kick-ass facts! Pew, 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 pew! I don't even know what part we're on, but more mishaps. The Vioxx scandal lasted from 1999 to 2004. Vioxx was a painkiller for arthritis and was found to increase the risk of heart attack and strokes. It became widely popular because it was marketed as being easier on the stomach than traditional NSAIDs such as ibuprofen and aspirin. In 1999, Vioxx was approved by the U.S. Federal Food and Drug Administration, the FDA, and became available on the market. It was prescribed to millions of patients worldwide. In 2000, early studies began to suggest that Vioxx might be associated with an increased risk of cardiovascular issues, including heart attacks and strokes. In 2002, a major study showed that patients using Vioxx had significantly higher rates of cardiovascular problems compared to those using a different NSAID. They studied naproxen. In 2004, following mounting evidence and pressure, Merck voluntarily withdrew Vioxx from the market in September. By this time, an estimated 88,000 Americans had suffered heart attacks due to Vioxx, and around 38,000 of those cases were fatal. The company eventually settled most of the claims in a $4.85 billion settlement in 2007. The E. Ferrell tragedy of 1983 to 1984. It was a vitamin E supplement marketed for premature infants and was linked to the deaths of 38 infants due to liver failure, kidney failure, and sepsis. It was introduced in 1983 and marketed as a treatment for premature infants suffering from retinopathy of prematurity, ROP, a potentially blinding eye disorder. It was thought that the vitamin E might prevent this condition, so Ferrall was administered in neonatal intensive care units across the country. The supplement had not undergone proper testing before being widely administered. Investigators determined that the fatalities were caused by the toxic effects of the specific formulation of Ferrall. The product contained polysorbates 20 and 80, emulsifying agents that were not typically included in vitamin E supplements. These compounds were believed to cause the adverse reaction in infants. The Bristol Heart Scandal, 1984 to 1995. At Bristol Royal Infirmary in the UK, high death rates were reported among children, particularly for babies under 1 year old undergoing heart surgery. The mortality rate for children undergoing complex surgeries at Bristol was as high as 30 to 40%, where the national average is around 10%. A public inquiry later revealed that the hospital had poor practices and less experienced surgeons were performing high-risk operations. There was inadequate oversight of surgical standards and failure to intervene despite knowing the high mortality rates. The teething powders disaster, 1900s to the 1950s. Calomel teething powders, widely used to soothe teething pain in infants, contained mercury. At the time, the toxic effects of mercury were not known, and the powders were marketed as safe. Prolonged use led to mercury poisoning, which caused a condition known as pink disease, acrodynia, in many children. Acrodynia comes from acro meaning extremities and dynia meaning pain, reflecting the pain and discomfort in the hands and feet. The human tissue scandal, 1999. A scandal erupted in the UK when it was revealed that hospitals had been retaining the organs of deceased children without their families' consent, particularly at Alder Hey Children's Hospital in Liverpool. Hospitals were taking organs for research and educational purposes, sometimes for decades, without informing or obtaining consent from the families of the deceased. The scandal led to the Human Tissue Act of 2004 in the UK, which established legal requirements for consent in the removal, storage, and use of human organs and tissue.